Hi, I'm Rathiroopa. I'm going to talk about access to bare necessities in India. The Economic Surveys of India 2020 to 2021 study the access of people to basic necessities like water, sanitation, housing, electricity, and clean cooking fuel. An index called Bare Necessities Index (BNI) was used at urban, rural, and all India level using data from two NSO rounds 69 and 76. 26 indicators were summarized on 5 dimensions of access to water, housing, sanitation, microenvironment, and other facilities. According to the Economic Survey of India 2021, states like Punjab, Haryana, Gujarat, and Kerala had the highest access to minimum necessities, while states like West Bengal, Jharkhand, Odisha, and Tripura had the least access. The states showing improvement on the access to bare necessities, which were red in 2012, became yellow or green in 2018, or the states which were yellow in 2012 became green in 2018, which are Haryana, Punjab, Uttarakhand, Kerala, Gujarat, Rajasthan, Uttar Pradesh, Madhya Pradesh, Bihar, Chhattisgarh, and northeast states except for Tripura, Nagaland, and Meghalaya. In rural India, the highest access to bare necessities in 2018 is recorded in Punjab, Kerala, Sikkim, Goa, and Delhi, while the lowest in Uttar Pradesh, Madhya Pradesh, Bihar, West Bengal, Jharkhand, Assam, Odisha, Manipur, and Tripura. The states showing improvement in their access to bare necessities are Jammu and Kashmir, Punjab, Rajasthan, Gujarat, Karnataka, Maharashtra, Chhattisgarh, Andhra Pradesh, Tamil Nadu, Kerala, Goa, Meghalaya, Madhya Pradesh, Manipur, and Arunachal Pradesh. In spite of improvements in access to bare necessities by people in 2018 when compared to 2012, disparities still exist between rural and urban across different states and across different income groups. On the positive side, the results of the survey say that interstate disparities in the access to the bare necessities have declined in 2018 when compared to 2012 across rural and urban areas. The state which had low access levels in 2012 have gained relatively more between 2012 and 2018. The improvement is noteworthy because the rich people can seek private alternatives, go for better services, or if needed can move to areas where public goods are better provided for. But the poor rarely have such choices. The survey used data from the National Family Health Service to correlate the BNI in 2012 and 2018 with infant mortality rate and under 5 mortality rate in 2015 to 16 and 2019 to 20 respectively, and found that the improved access led to improvement in health indicators. Similarly, we also find that improved access to the bare necessities correlates with future improvements in education indicators. The Economic Survey of 2020 to 2021 measure the progress made by states in providing access to the bare necessities, in addition to highlighting the significance of the healthcare sector amidst the COVID-19 pandemic, calling for an agile healthcare infrastructure in the country. Access to these essentials have direct linkages with health of household members, and is also regarded as an important barometer of economic development in academic and policymaking circles. Better sanitation and drinking water facilities help prevent the spread of communicable diseases, and access to bare necessities along with medical care, transport, and schools is essential both as a direct component of well-being of people as well as serves as inputs to productive capabilities. According to the Economic Survey of 2020 to 2021, India needs to design an appropriate strategy in order to achieve the SDG goals by the year 2030. According to the survey, government schemes like SBMG, PMAYG, Jal Jeevan Mission would be helpful in designing strategies in order to overcome the gaps and also to enable India to achieve the sustainable development growth goals of improving access to drinking water, sanitation, and housing, and reducing poverty by the year 2030. Needier people in rural and urban areas should be effectively targeted, and there needs to be an effective convergence in the implementation of schemes of the center state and the local level. Thank you.